Today we are going to talk about numbers. It's not really my favorite topic in the world, but it is critical that you know some very key numbers about your practice if you want to establish where you are from a financial health standpoint. Hi everybody, it's Jennifer Smith, and today we are going to talk about numbers. It's not really my favorite topic in the world, but it is critical that you know some very key numbers about your practice if you want to establish where you are from a financial health standpoint. These numbers will be important for you to know to establish where you are now and then to make a plan for where you want to grow that practice to. Remember, I teach all the time. You can have a practice the size that you want, whatever that might be, and I'll help you get there. I'll show you the steps that it takes to grow your practice to whatever size you have your dream practice in your mind made up to be. But first things first, let's figure out what your numbers are so you know how much you actually have to grow. The first two numbers that you have to know, these are the easy ones. Usually your practice management software can pop these out for you, no problem at all. The first one is revenue. You have to know how much money is coming in from all sources, so gather that number. The second, this takes a little bit more work, overhead. What are your overhead expenses? Where is your money going? Make sure that you've got detailed tracking of your overhead and you want to compile that as well. Now, once you have your revenue and your overhead, you can get a good rough estimate of what your profit margin is. So how much money do you actually make? How much money is left over after all the money you brought in and all the money that has gone out? This often will relate directly to how much you are paying yourself, but it is important that you establish what these starting numbers are. Another very important number for you to know, your accounts receivable. How much money is still out there in the world that still needs to make its way to you. It is always important to be tracking this number rather closely because it can impact things like your cash flow and even how you make some decisions about purchases. So make sure you've got a handle on your AR numbers. The last numbers that you need to know, and in my opinion, the most important numbers by far, are your KPIs, your key performance indicators. Now, every practice may decide that they have different KPIs that they're tracking than other practices. I'm going to give you a bunch of examples of some KPIs that I think you should be tracking, but ultimately you get to decide which ones are the most important, and then you need to track these and you need to know these. Here are some KPIs that I think you should be tracking. Number one, what is your average revenue per patient? Number two, what is your new patient call to new patient booking rate over the phone? Number three, what is your case acceptance rate? And number four, what is your patient retention rate? How many patients that you have now are still patients 6 months or 1 year from now? I also think it's wise to track your hygiene rebooking rate and also to track how many reviews are going up online for you every single month. Those are just some simple examples of some KPIs that you can track, but KPIs will ultimately tell you day to day and trends over time of how the things that generate revenue within your practice tend to be trending. So all of those numbers are important. You should know all of them, and putting them all together will let you know the financial health of your practice right now and will help you set goals for where you want to take your practice to next. It would be fantastic if you subscribe to this channel, hit a like on this video, and check the description below where you can join my free private Facebook group, which is made just for women dentists and dental specialists, where I teach you all of the things you could want to know to build your dream practice and your dream life. I will see you there. Bye-bye.